Welcome, everyone, and thank you for joining today's webinar, which is part of the Zoonotic TB subsection webinar series of the Union. And we are really happy that you are here with us today. So today is a real pleasure to introduce our speaker. She doesn't really need introduction, but we will have Professor Katharina Kranzer, Professor of Infectious Disease Epidemiology at the London School of Hygiene and Tropical Medicine, and also the chair of the Committee of Scientific Activities of the Union. So in today's session, Professor Kranzer will show us the road to Rio, so how to write a strong abstract for the Union World Conference on Lung Health 2026. Professor Kranzer is a globally recognized expert in TB and HIV and brings extensive experience in both research and also scientific leadership. Today, she will share practical guidance on what makes a strong abstract for the conference, and which will be held in Rio de Janeiro during November 17 to 20th. And she will also show us what reviewers are actually looking for in an abstract. So just a quick note on logistics. This webinar will be recorded and will be posted both on the Union website and, just like the other Zoonotic TB webinars, on YouTube. Microphones will not be enabled during the webinar due to the large amount of attendees, but please feel free to post your questions in the chat at any time, and we will address them during the Q&A portion at the end after the presentation. We apologize in advance. We might not be able to answer all the questions due to the high number of attendees, but we will do our best to answer them afterwards and send to everyone the answers. Professor Kranzer, thank you so much for being us today, and I'm delighted to hand it over to you.
Thank you very much. I'm just very briefly showing my face because I'm based in Zimbabwe and we have sometimes internet works. And so I'm going to thank you everybody for joining us, and thank you for the interest in the conference. We are delighted to have you here, and I hope that what I'm going to present will provide some answers on how to write strong abstracts. And Liliana said a question and answering session afterwards. So very quickly going to think aloud, what is the point of submitting an abstract? So why do you submit an abstract? So you want to disseminate your work, and so it is about reporting novel findings, but also doing it in an accurate way so that you summarize your work. What is important when you submit an abstract is you need to convince the program committee to accept it. So you need to it needs to be interesting enough for them to accept it. You also need to convince the conference audience to attend your talk or visit your poster. So, in the Union abstracts, because of embargo, the main abstract, which is reviewed by at least 3 reviewers, but then you have also a 50-word summary, which is what people see when look at the program. So even that needs to be written interestingly enough for people to actually want to and hear you speak or see you present and hear you present. And then it obviously must convey a scientific merit and importance, because the conference in the end is a scientific conference. So often people who have never reviewed themselves don't really know what the reviewing process is. It's good to know what the reviewing process is so that you then take that into account when you submit your abstract. So each abstract at the Union is sent to a minimum of 3 reviewers, but we often try to have more than 3 reviewers. So 3 is the minimum. Anything which hasn't achieved 3 reviewers usually ends on my desk, so that there is at least another 3rd person reviewing it. Then the scores of the reviewers are averaged, and then there is a cut point which is decided. Below that cut point, everything gets rejected. So that cut point is partly informed by how many submissions we have, but it's also informed of, how many rooms are available to actually fill to have for presentations and e-posters. And once we have this cut point, is obviously not a complete final cut point. Things which are around the cut point are taken to the conference committee, program committee, to then make a decision. Some of them might still enter if they are below the cut point, and some which are just above the cut point, there might be the scientific committee might make the decision that it doesn't actually warrant presentation. So the conference program committee meets for 3 days, and we are about 12, 13 people who meet. And it's important that you know that, because you will see how many abstracts we have to actually make decisions on within these 3 days. as I said, a subset of the abstract at the cut point are re-reviewed. So the conference committee will look at them again to actually make a decision, should that not actually be included or not. And then within minutes, people have to decide, do they reject an abstract? Do they give the abstract an oral or a poster? Or is it going to be an alternative abstract in case we need to fill spots? People don't have a lot of time to try to understand complicated diagrams. Your message needs to be clear, and also your figures need to really contribute in order to make sure that it actually all hangs together. The aim of the reviewing process and the scientific committee kind of program planning is to choose exciting and high quality programs. And the reason for that is because we obviously want people to come to the conference. We want the best experience possible, and we can only do that if we have a high quality program. The acceptance rate in 2025 was 44%. Of 50, you can see that during committee we had to sweat. So that makes it clear that, you know, it's important that your message is as clear as possible. Your methods are well laid out, so that people think, okay, this is an abstract we really need to take. Now, if you look at the acceptance rates over the years, so in 2018 in The Hague, we had an acceptance rate of 49. In Hyderabad, we had a 52% acceptance rate slightly higher during the virtual meetings. But then what you can see is that year on year, we have higher submissions. So while we had just above 2,000 in 2018, now we are actually sitting very close to 2,600, and we're expecting in real to have even more submissions. What that means is we are not more rooms available or more e-posters available. What it means is competition will become harder. And that means that you really need to make sure that your abstract sets you apart. Now, I'm just going to share very briefly reviewer scores. So this year, the actual reviewer score, which took you through, which was the cut point, was 13.6. So if you had a score of 13.6, then you had a high likelihood to get an e-poster, and then once you had a score, had a high likelihood of getting an oral abstract. With the highest submission in Nigeria, followed very closely by India, drop, and we come to China and the US. You can also see that the mean score for Nigeria is 12.6. That means that more than half of the abstracts were rejected, so 62% were rejected, versus if you look, for example, at the UK with a mean score of 14.5, far less abstracts, obviously also a much smaller country, but the rejections were only 26%. Also, just as a kind of to start the thinking process, which often doesn't happen in scientific organizations, more than 50% of our delegates at the Union Conference are women, and we would like to see the same representation in people who submit abstracts, and people who chair, and people who actually speak at plenaries. And you can see that that kind of percentage of abstracts submitted by women varies hugely across countries, but we would like to encourage research organizations that they consider and encourage their female researchers to submit abstracts. So when you think about the reviewer, if you have yourself never reviewed, then it is a process which takes time. It's done voluntarily. So nobody is compensated for and usually reviewers get researchers to review, and they might be assigned abstracts which are kind of outside their specific area of expertise. So again, it's really important. We can't guarantee that every reviewer is going to be an expert in your subject matter. So it's important that you don't make too many assumptions. Obviously, you can assume that people know what TB is, you assume that people know what Mycobacterium bovis is, but you shouldn't kind of use too many acronyms, and you should try to describe what you have done so that you make it easy for the reviewers. The reviewers decide on the basis of scientific merit, originality, the importance and general interest. They also kind of can, if they think it's suitable as a talk or as a poster. And then it's important the reviewer also also takes out if there is stigmatizing language used. And as is very kind of, dedicated to not for people not to use stigmatizing language. Previously, in previous years, people would get deductions if they use stigmatizing language. I'm not sure that is the best way of kind of feeding back, because nobody really knew what their score was in the end. So how should they know if they had a point deducted? So this year we will point out stigmatizing language and ask reviewers to feed back to people who submit, to say, just as a note, this is not this wording, like a wording such as defaulter is stigmatizing language, and we would ask you to revise that, so that there is a bit more of a dialogue than simply saying, we are deducting a point. So now I'm briefly going to talk about abstract types. So there used to be at the Union 2 different abstracts. One was called scientific abstract, and the other one was called policy and practice. For me, that doesn't really make sense, because we are a scientific conference. All abstracts should be scientific. And what is meant with policy or in practice is more kind of operational research usually, or implementation research or programming experience. But even that can be presented and should be presented as science or in a scientific way. So we have essentially now done away with this categorization, and there are now two formats. One is the option 1, which is really and like the typical research abstract which you would find in a paper, with the background, methods, results, and conclusion. And then there is the option 2, which is kind of more suitable for abstracts describing lesson learned, or abstracts which are more from implementation science or program managers. And the headings there are background, its description, lesson learned, and conclusion. But it doesn't mean that there shouldn't be methods. In the description, there should be a clear overview of the program or the project or the policy, or like things like how long did you implement something, what was the setting, where was the location. It should describe which population it was kind of applicable to, what are the key activities. And then the lessons learned should also not be void of any results, like shouldn't be void of any analytical results. So they need to include very appropriate statistical tests. And if you include proportions, then you should have raw numbers as well. They should, if possible, be disaggregated by age and sex, because that often really gives a different understanding. And then there should be a suitable conclusion. Now, again, it's often useful when you submit something to understand the scoring system, because once you understand the scoring system, you also know what we are looking for. So the scoring system has altogether 7 parts. The first one is relevance. And relevance only scores you 1 point. And that's the question of, is what you are submitting relevant to the conference? I.e., is it about lung health? Is it about TB? Is it about One Health? Like, is it relevant? If it is thought to not be relevant, then this gets a 0, and the reviewer will not actually review the rest of it. So if you, for example, submit something on, I don't know, mother to child, HIV mother to child transmission, which isn't relevant to lung health, that will get a 0, and therefore it gets kicked out of the reviewing system. And then the other kind of matrices we assess things on is innovation, significance, design, methods, and results. All of them score between 0 and 4. And then there is conclusion, which only gets a 1 or a 0. And the conclusion should really usually not be much more than a 1 sentence. So I'm going to go through these different scoring criteria for you to better understand what we are looking for. So if we are looking for innovation, for example, then the special consideration is, are there new insights? The new insights don't need to be that you are using a new drug and nobody has ever used them before. It can be a new method. It can be a very different angle on an analysis. And there's also obviously merit to replicate things. So there might have been already a trial on, I don't know, drug-resistant TB, a special drug, and you are replicating it. That is important. That might not get you a 4 for highly innovative and paradigm shifting, but it might give you a 2 or a 3 because it's somehow innovative, and or it's innovative in context. So sometimes also using a certain method or using a certain intervention in a different context that has never been used before might also be considered innovative. Now, if you think about the design considerations, then the design considerations are kind of slightly different from the methods scoring. The design is really about, is the design appropriate to answer your question? That doesn't mean that every study needs to be a randomized controlled trial. Sometimes you cannot do a randomized controlled trial because you can't assign people to smoke at random. Sometimes it is an observational study, which is the most, the best way of investigating something. Sometimes it is about kind of, like a social science approach is the best approach. So it basically asks the question if the design you have used is strong and appropriate for what you are asking. So it hangs very, very much together with your study question. Now, the design is obviously kind of linked with the method description. And again, the method description is scored from 0 to 4. And if you don't describe your method, nobody will be able to assess your design. So if you score a 0 on methods, you will also score a 0 on design. So it's important that you describe the methods in enough detail that the reviewer will understand what you have done, will also understand how the methods relate to your results, and is also able, because that's always at the back of our mind when we review, was this actually really done? Yeah? That doesn't mean that everything which is submitted is a fake, but obviously we need to kind of make sure that what is submitted has been conducted as a study, and therefore describing your methods in detail gives the reviewer confidence that it was actually, conducted and done and the data was collected. So when you craft an abstract, it's almost as if you're doing an elevator pitch. Yeah. So first of all, the thing is, the abstract matters because it gives you a platform to disseminate. Going to conferences is an important part of scientific academic life. It gives you a network, it gives you a platform. And once you have presented on a podium, people will remember you if you have done a good job and you did a good presentation. And the people who obviously come to a session usually are interested in what you're saying. So it is a really good way of increasing your visibility, your network, and disseminating your important results. It is a question of first impressions. If the abstracts, or for example, also the figures in an abstract are really poorly done and you can hardly read the writing because it's such small font, or people use a lot of different fonts or rainbow colors or whatever, then already as a reviewer, you feel like this is probably not going to be a strong abstract. The same holds true about grammatically correct abstracts and typos, errors in kind of small and capital writing. All of these things, when people review, and that's the same when you are reading papers, they are really annoying for a reviewer, and that kind of sets the tone when they assess the abstract, because we all get biased by things which are kind of beautifully formatted versus things which might not be so beautifully formatted. So it's really the first impression matters. When you craft a not so strong abstract, what you do is you submit work which is not relevant to the conference. It's not clear why it is important. What you're submitting might be of interest to a tiny group of people, maybe yourself and a couple of more people. So if that's the case, then that is not really what you should submit to an international abstract. The research is unsound, and most of the time it might not be that the research is unsound, but the way it is described isn't well enough described to really make an assessment if it is sound. It's not clear what the authors have exactly done. The theory is unclear or unsound. The work, and you will see that in an abstract I'm showing, might actually not even have been carried out. So there is a lot of we are planning or we will do, so which makes the reviewer think it hasn't been done. The results are not statistically significant. That doesn't mean that only statistical data means and the kind of understating what the data means. Both of that are not good ways about writing a conclusion. And go through the key elements of an abstract. And as I said before, usually, like if it is a scientific, like if it is an option one background, which ends in the objectives or your study question, the methods, the results, and the conclusion. Now, for the union, the abstracts are allowed to be 300 words. We do a lot with a table. Obviously, the rows are limited, but we can also confer a lot of messages figures. So if you include a figure, make sure that the figure is additive and is not just repeating what you're saying in the 300 words. Because 300 words is not a lot, and you really have to write concisely, which is difficult. So the figure really gives you the possibility of kind of results, which might need too many words to be described. The common weaknesses in abstracts is that there is an unclear study question. The best background section actually ends in a study question so that it's very clear of what you're trying to achieve. The setting isn't well described and the population isn't well described. It's not enough. I said, if the methods don't have enough detail, you will not score highly on the design because nobody can assess your design. There is a lack of concrete data. Often abstracts say, oh, there was improvement, but they don't say improvement in what, how did you measure it, how much improvement. So these are kind of the missing details. And then there is often interpretation issues. So there is limited analysis across key characteristics. So for example, often the abstract submitting TB case finding, or like a lot of those submissions around TB case finding. And all there is described is we screened 15,000 people, we found 1,000 people with signs and symptoms of TB, we did 900 words, and then we diagnosed 40 people with TB. That's not very analytical. It would be, what is my catchment area? How many people of that catchment area have found? How many men, how many women participated in the screening? Was the screening more successful in certain age group? That is what is analytical, not just describing a cascade. Also, we often see overinterpretation of results, where people have interpretation doesn't really link to the data. And then there is also often very generic kind of language, which is not very precise, which makes it difficult to really understand what I want to say. I'm going to go on and show you examples, one example of a low scoring and one example of a high scoring abstract, and kind of lead you to how the scoring would work. Just to say, the high scoring abstract is a real abstract which was submitted, and we have agreement from share that abstract. The low scoring abstract is an abstract which is significantly changed features and unrecognizable from the initial submitted abstract. So scoring abstract, you can see the interventional response, results, impact, and conclusion is kind of points towards that this was submitted under category. And I leave to just read it through. A major public health challenge in one country, so we don't name the country, especially under this trying to treat TB. There's still a large gap between how many cases are estimated and how many are reported. There are problems that needs to be done to raise awareness and strengthen service. Feedback
Sorry, everyone. It looks like Katarina has dropped off the call. She's in Zimbabwe and she has poor internet connection. She's just trying to relog in right now. So just bear with us 1 second. We will be recording, we will be sharing these slides afterwards, including all the questions that are posed. So we will get to this content, but she's just signing in now. So just bear with us 1 second, please.
Very sorry about that. Yeah, I'm now in my hotspot. I apologize. I'm not quite sure where you lost me. Tyler, could you tell me?
Yeah, if you can start at this slide again, please.
Okay, no problem. So again, sorry for that. So this abstract, yeah, I leave you for a minute to, and you probably had a bit more time while I was reading to read it. But just to say, the background is very lengthy, doesn't really convey a lot of new information, and it could have been probably done in 1 or 2 sentences. The intervention is to solve this problem. A project was planned to improve detection and response. It aimed to increase awareness, build capacity, and use better tools. The approach involved healthcare workers, community stakeholders. Some diagnostic methods and awareness activity were also mentioned as part of the plan. The project hopes that by doing these things, detection will improve. So there is a lot of hope, there is a lot of planning, and it's not quite clear what intervention was done. Then it's also not clear how the intervention was assessed. In the result part, they write some data were reviewed to understand the situation. It was found that the gap is still big and that children are particularly affected. Younger children seem to have highest challenges. The reason for this could include low awareness, difficulties in diagnosis, and limited access to care. The findings show that further attention is needed. Again, no data, no numbers, no qualitative interviews. One doesn't even know how the data was collected. And then the conclusion, the TB detection gap among children is a serious issue. There is a clear need for better strategies, improved diagnosis, and more engagement. The findings suggest that collaboration between different sectors will help improve outcomes. More resources, awareness, and policy focus are required to reduce the gap. Again, this is not backed up by the data and is a very generic summary of which we could all have written if we would have done some pediatric research. So now, if we ask the question, as you know, with our scoring system, is this abstract relevant? And the abstract speaks about TB, so this scores a 1 on relevance. So it will be further assessed, essentially. The next question is innovation. So what is the innovation? The innovation is to solve this problem. A project was planned to improve and detect and response. It aimed to increase awareness. So again, this is, there is no innovation because we don't even know what the project was about. So it scores a 0, or if one is very nice, maybe a 1. The next question is significance. So the difference between innovation and significance is innovation really asks the question, what's new? Versus significance is a question of, is this something which will actually change guidelines? If it works, do we have, will we change any of our understanding? So this is not so much about innovation. This is about significance. For example, would score highly if a drug has already proven to be useful in MDR TB treatment, and now we are repeating the trial and we are showing the same. That is significance. Now, is it significant? Well, I mean, the authors want to make us believe it's significant because it continues to be a major public health challenge in one country, especially for children. But there isn't anything which will say if this intervention, which we don't know what it is actually working, what will it do? So again, difficult to assess, but is a 0 out of 4. Now we come to design. A project was planned and some data was reviewed. So we do not really know what the design is. The methods are not described. And therefore, it might be the appropriate design. It was probably some sort of programmatic implementation design, some awareness campaign, but we don't really know. And in the design, it's not just the question, what was the intervention, but the question is also, how did you actually assess the intervention? What results did you, like, where did you generate the data to assess the intervention? But we don't know. So scores a 0 out of 4 for design. And the same holds true for the methods, because we don't really, apart from that, we know that all of these people were involved and that some diagnostic method was used and some community awareness. We don't really know what the method was of both the implementation part and the assessment of the if the intervention worked or not. So again, a 1 or a 0 out of 4. Now, with regards to results, there are no results, as you can see. Some data was reviewed to understand the intervention. Gaps were found, but the gaps are not displayed. There is no kind of, I don't know, a proportion of children with TB which are undiagnosed. We know there's literally nothing we can kind of say we could call results. So for that reason, again, the results are unclear, they are minimal and confusing. And then last part, the conclusion is, as you can see here in the on the right, the conclusion is not really back and is extremely generic, and therefore to definitely not be going through for review at the scientific committee. Now, if we are looking at an abstract which scored very highly by the 3-4 reviewers who scored them, which is called One-Day TB Diagnosis Resistance Mapping with BD-MAX, MDR-TB, and ONT-AMPOR, then the background is also relatively long. The background speaks about targeted sequencing and that for a lot of drugs in the MPAL regimen, there isn't any fast resistant testing available. But then it very quickly goes actually into their objectives. So they use the background to actually write the objectives. We address this by combining BD-MAX MDR-TB test with the AMPOR targeted NGS assay. This one-day diagnostic platform enables comprehensive analysis from a single sputum sample within 1 working day. So they are investigating if they can make that work. The methods are clearly described. The spiked samples were created, and then with diverse resistant profiles. Clinical samples were also collected in 2 different hospitals, one in Germany and one in Tajikistan. Samples were then analyzed using the BD-MAX assay. DNA was recovered, and then the ONT-AMPOR assay was done as a follow-up, and discrepancies were investigated with whole genome sequencing. They then described the entire workflow. They actually also have an inlay, which is a table, as you can say, or a figure, where they actually really think about it, how you can make that work in a working day. They then don't just give you how long it takes for each of these steps, but they also tell you that when you use samples with a CT value under 28, what your success rate is. And then the conclusion is, integrating BD-MAX offers a rapid, accurate, and comprehensive diagnostic tool for MDR, XDR, TB, with the potential for same-day results, which is kind of backed up by results and also feeds back to the background section. Now, if we go through it, is it relevant? Yes, it's relevant. So it's TB diagnostic, scores a 1 on relevance. Is it innovative? Well, yeah, it is innovative. It has never been done before, so it's highly innovative, so would get a 3 or 4. Is it significant? Well, for MDR-TB patients, it's highly significant, especially if they start them on BPAL-M regimens, because there's a lot of bedaquiline resistance. So yes, if it works and if it can be implemented, it will be highly significant. The design is you can do other designs, but they use two different ones, spiked samples and clinical samples. They also investigate discrepancies. They obviously, because AMPOR is not yet WHO endorsed, they haven't used it in patient management, but from a laboratory point of view, it's a pretty good design and it's very well described. So it's appropriate, rigorous, and clear, so it probably gets a 3 or a 4 out of 4. And we can only assess the design to that degree if the methods are well enough described, and they are. So it will also get on the methods a 3 or a 4. The results, it provides actually, results with actual numbers and more details on the numbers. And yes, one can always want more results, but they have to do it within 300 words. So, and they have used their kind of figure sensibly. So it again gets a 3 or 4 out of 4. And then the conclusion is backed up by the data and all makes sense and hangs together. So for that reason, the conclusion also gets a 1 out of 4. And you can immediately see that this one, if you think 1, 2, 3, 4, 5 times 3 would already be either 15, 16, 17, or it would be if we score it as highly as 4, it would give the maximum score of 22. So that's just to talk you through how does an abstract look like, which is like a strong abstract. Now, I just want to give you a couple of writing tips because I have myself a lot of early career researchers who, like I supervise as PhD students or who are in positions of study coordination as postdoc, but very early in their postdocs. And obviously, there is people need to go to conferences in order to really make themselves known. So it's important to ask them to and help them and support them in writing abstracts. So the first thing is check your submission deadline. It's not good to write an abstract a day or a week before the submission deadline. You should know when the submission deadline is and make a plan 6-7 weeks before. And for the union, we are already within the 6 weeks window. I will show you when it's opening the abstract submission. Allow enough time to draft and review because your co-authors need to review it. They need to sign it off. They probably, only if you give them enough time can they provide detailed input to make your abstract better. Check the formatting and the content guidelines. Make sure that you don't create abstracts which are 500 words, which then means cutting the words is always difficult. And then start writing. It's always the most difficult thing to put the first word on on paper or on a computer screen. That's the same when you are writing papers. It is difficult. It sometimes feels like you're extremely constipated and you just can't make yourself do it. But once the first word is out, everything else gets a tiny bit more easy. And we are all procrastinating. I mean, I don't like writing. If I could just submit tables, that would be my preferred option. But if we don't write, we will not be known. So it's a really important part of the journey. You need to understand your audience. So depends what kind of specialty you are, but if you have been at the TB Union conference before, you will know who goes to the conference. There are policymakers, there are implementers, there are like basic scientists, there are clinicians, there are biomedical scientists, so laboratory scientists. So think about who might review this abstract and think about what first impression you want to give and make sure that the title is not too catchy, but good enough that people will actually want to read. Follow the abstract structure, be clear and concise, and use direct language, not passive voice, because direct language means you use less words. And it's always like wordsmithing is what it comes down in the end when you kind of need to fit it in the 300 words. There are sometimes conference themes. In some conferences, we ourselves don't necessarily have conference themes, but if there are, make sure you align conference themes. Look at your language and look at your formatting. While we don't encourage, so I would not encourage you to use ChatGPT to write your abstract, but proofreading it is definitely a good thing because it will pick things out. So make sure that if you use AI, that you do it like in an intelligent way, that you don't, if you don't know how to write the abstract, ChatGPT will not know how to write the abstract either, because the critical thinking comes from you. if it is about proofreading, or if you don't find a certain word, then by all means, I think if it kind of maybe sometimes is a bit of an equalizer. English is also not my first language, so I find it sometimes very difficult to find the right word or write as concise as my colleagues from the US or the UK who have grown up in speaking this language and have written and read a lot in English. Allow time, so time and preparation when you do your conference presentation. So if you are selected for a conference presentation or also an e-poster, make sure that you have enough time and that you prepare and that you do mock presentations with your colleagues to make sure you are on time, to make sure that your font size is big enough on your presentations, that it's nicely formatted. In the end, when people see you give a slick and really superb presentation, people will remember you and they will want to reach out to you if the topic is of interest. So it's really a way of PR for yourself. And it is a key for dissemination and academic careers, and also an opportunity for networking, but also for receiving feedback and collaboration. So if you do get accepted, make sure you put a lot of time and effort into your presentations, into the rehearsing, and also into the formatting of your presentations and e-posters. So we all, I think, have problems meeting the word limit. And one way of doing that is look for obvious redundancies. Use the abbreviations where you can. But as I said before, your reviewers will not be experts. So what might seem as an obvious abbreviation to you might not be for your reviewer. So you will have to spell it out when you use it the first time. Use a table where you can, because it will save you words, or a figure. Don't give more stats details than you need. So, like putting a p-value is fine, but you don't need to give like detailed breakdowns if you already have a table. And avoid the passive. So the passive voice, because that always uses more words. So yeah, so that's I've already said that. And then just to say, I sympathize with everybody who has to write an abstract. It's hard work. It takes usually much longer than you think. That's the same with publications. It goes round and round in circles, but this circular process makes these scientific communications usually much, much better than the first draft. Allow at least a week. I usually say to my PhD students, I can't review things in the middle of the night. You need to make a plan. Tell me when you send it to me so that I will be able to actually give it enough time and review it in a timely manner. As I said, conference presentations are a key part of presentations, of dissemination. Especially oral presentations, can be really frightening, but they are an opportunity to network and to receive feedback, which means that your results will be better and the interpretation will be better. And obviously collaborations means one can expand one's network, which is always good. Now, I just want to end with giving you the dates for the conference. So the Abstract Mentor Program, which the union runs, and which means you can submit an abstract to that program and you will get one round of feedback, opens on the 18th of February. Ideally, before you go to the Abstract Mentor Program, you should already have received feedback from your senior authors and co-authors to really make the most out of it. The submission dates for abstract are the 18th of February to the 9th of April. So while we are near to the submission opening, you have definitely more than 6 weeks for submission. So if you want to prepare an abstract, do it now and start talking with the people who need to maybe help you with analyzing, or the people who will review it. The abstract mentorship program closes on the 19th of March. The reason for that is to allow people to change the abstract for the submission date. We have our program selection meeting from the 2nd to the 4th of June. So what that means is that after the 9th of April, there is about 4 to 5 weeks where we will send these abstracts out to reviewers and to get at least 3 reviews. Then all of the scores are compiled in mid-May. Then a tentative decision is made on where the cut point sits. And then we go to the program selection meeting and arrange the program, which is not that easy because, you need to have oral abstract-driven sessions which hang together on the same topic, the same for e-posters. So it's a big undertaking and takes quite a lot of time. And then there will be late breakers. The dates for the late breakers are not yet confirmed. They are usually opening kind of in July, August, and are open for 4 weeks. The late breakers, there is the general late breakers, and then there's the student late breakers. Both of them open at the same time and close at the same time. And then the union conference is from the 17th to the 20th November in Rio. And if I may just use this opportunity to also say that it's the first time that the union conference, or not the first time maybe, but we haven't been in South America for a long, long time. We are very excited to have the union conference there. South America has decent amounts of TB, but it also, there are other respiratory issues which are of importance. That means that we might have, it would be great to have more submissions on chronic respiratory disease, such as, asthma or COPD, occupational health disease, which goes very much with the One Health angle of, Mycobacterium bovis, zoonotic TB, but equally avian influenza, other occupational health hazards such as silicosis or other inhaled substances. We would also welcome, submissions on air pollution or heat, and equally, respiratory infections outside of TB, such as RSV or pneumococcal disease or fungal disease. So while obviously a lot of the content is often TB related and a lot of delegates come because of the TB related content, we do acknowledge that in South America, there is a lot of, in a lot of other countries as well, but in South America, the priority between, for example, TB and other respiratory diseases might not be the same as, for example, in some of the Southern African countries. So please submit high quality abstracts. We are really looking forward to seeing them. We are also looking forward to seeing you in Rio. And last thing, just to pledge, there will be what we call a regional track where you will be able to present either in Spanish or in Portuguese. However, the abstract submissions for that track, to ensure that we can provide enough reviewers, will have to be in English. So the abstract has to be written in English, but the actual presentation will then be done in Portuguese and Spanish. And we will also have at least one, maybe another room where there will be translation services from English into Spanish and Portuguese. And I think that's all from me. So I'm going to stop sharing. I hope that you could hear me all, and back to you.
Thank you so much for a really, really informative presentation. We do have a few questions that I would like to go over. First, I would just like to confirm that we received the confirmation from the Union Training Education Department that the slides and also the recording, they will be shared with everyone that needs to access them. The first question that we got was, when you say that results that are not statistically significant is a limitation, is there not value in submitting null results to share with other researchers? And apologies if I misheard this or misunderstand the point.
Yeah, so you're absolutely right. That is the fact that submitting, sharing null results is extremely important. Maybe even sometimes more important than sharing statistically significant results. It's just about, if it's not statistically significant, drumming up as if it was statistically significant in the conclusion is not the way to go. It's fine that it's not significant. And then the conclusion it didn't work, which is a good conclusion. And the conclusion might be it worked in contrast to another setting. Here, it didn't work. The reasons for that might be A, B, C, D, and that can be included in the conclusion. Sometimes an intervention is context specific, so therefore it didn't work in another intervention. Sometimes the power of your study wasn't big enough. Acknowledging these limitations is absolutely fine within the conclusion, but saying that something worked when it actually when the results don't link up to it, that's the problem.
Okay. Another question is regarding innovation and relevance and how they are assessed. If a topic is innovative or highly relevant within a specific geographic context, but represents an established practice in regions with more experience in some specific approaches to TB care, for instance, would it still be considered innovative overall for a conference presentation?
Yes, so just to say, relevance is a yes-no question. Yeah, so relevance is about what you submit. Does it have something to do with lung health? Yeah, so that if you score a 0 on that, the abstract is not going to be further assessed. You're absolutely right that innovation is not just innovation of, I don't know, as I said, a new vaccine or something. Yeah, innovation can also be, it has never been done in this context. It has been done in this context, then it should score at least the 3. And if the scoring criteria when you submit your abstract will be on the conference website. And in addition, there will be a film for people who submit and for people who review on the scoring criteria. So innovation doesn't mean, like, innovation can mean a lot of things. And sometimes it's a methodological, like even within the study design, a methodological innovation, which isn't necessarily an innovation for an intervention. Yeah, I mean, there are lots of ways of showing innovation, but using something in a different context is definitely innovation. There's no doubt about that.
Okay. Another question, this is more about the structure of the abstract. So must the table, and according to your example of the high scored abstract with the table, must the table be part of a section or can it be separate from all the sections as shown in the high scoring abstract slide? Additionally, do the words of the table have to add to the total word count?
So these are all very good questions, and these are where the wordsmithing comes in. So when you submit your abstract, you will see that there is a box for the background, there is a box for the method, there's a box for the results, and then there is an upload option. Yeah, so on that upload option, you would upload your figure, but there's also an inlay where you can say add table. And that add table option allows you to add, from the top of my head, I think it's 8 rows and maybe 4 or 5 columns. That's the max a table can be. And you basically construct that table in the submission platform, whereas for figures, you basically upload them. And so it's really important for your figures that you make sure that you have high resolution figures. I mean, we often get people who photograph their screen and then upload that photograph onto it, because for various reasons, they might not be able to save it as a JPEG or whatever. That is problematic because it then looks extremely blurry. And as a reviewer, you will not be able to actually properly review it. So the table is something which you construct within the submission like platform, whereas the figure is something you upload. And that's the reason why the table, a figure, you can upload a figure with as many inlays as you want in a way. Yeah. Whereas with a table, you're restricted with the amount of rows and columns. The words in the table do not contribute to the word count. The word count is only what you put into the boxes.
Okay. And what about figures? Is it possible to add text to the figures, or would that be discouraged?
I mean, that would be a bit cheating. Yeah? Like, I mean, obviously you have to have some text in the figure because you need to label your axis and you need to say red is, I don't know, or blue is woman and pink is man or whatever. Like, I mean, there needs to be legends, but explaining additional results, I would not do that because people who review, they have been in the position of submitting abstracts and trying to dodge the system. So if I see something like that, I wouldn't review that too positively. Yeah.
And I think we have just time for one more question. And so this is related to abstracts describing planned or early stage studies. If a study is just at the beginning or scheduled to begin later in the year so that no data are available by the abstract submission deadline, but could have more results by the conference time, how are such abstracts evaluated? In practice, how competitive are submissions that focus on study design, anticipated impact, and relevance rather than results?
Abstract to have a result. Like, it cannot be without the result. If you don't have results, then you can't submit an abstract. There is a late breaker abstract if you think it is so important that you want to submit, that you think it needs to be shown. That's the reason why there is a late breaking possibility for people who haven't got results at the time of the usual submission. And I mean, the conference is every year. So if you have like if you're planning something and you think you will have results in November, then maybe it's good to submit that one to the next conference.
We have 3 more questions, but just for sake of time, we will reply to those questions and send the answers to everyone. And I really would like to thank you all for being here to attending this really important webinar. And also, I would like to invite you to join me to thank Professor Kranzer for really giving us these really very, very important tips to submit a strong abstract to the conference. Thank you very much.
Thank you, everybody. And yeah, we are looking forward to your submissions. Bye-bye.
Bye-bye.